AFMC is really known.
That this video will provide ideas
And also make sure
between the office hours.
Welcome to this episode of AFMC TV. I'm Robin Ledbetter. Thank you so much for joining us. And today I have with me Dr. Chad Rodgers. He is a pediatrician and he is the Chief Medical Officer for AFMC. Thank you so much for joining us, Dr. Rodgers.
Glad to be here.
So we're going to talk a little bit about social determinants of health this morning and the ACEs project. So tell me, how are screenings for social determinants of health used in practice and in hospitals?
Yeah, you're really seeing more hospitals and more clinics doing more, we say SDOH or social determinants of health screening. So when you think about social determinants, those are things that affect your health that are not necessarily related to medications or your diagnosis, but might be where we say you live, work, and play. So, and also a lot of people will describe social determinants like your zip code is a greater predictor of your health outcomes than your genetic code. Because if you live in poor housing, or you don't have good access to food, or you don't have good access to transportation, all those dramatically affect your health, especially if you don't live in a community where you feel safe to exercise and stuff like that. So what the number is, they say that about 80% of healthcare is determined outside of the hospital, outside of the clinic. So screening for those social determinants are really important. There's a lot of different screening tools. People have really usually implemented whatever is kind of within their electronic health record. So if you've gone to your doctor, you may have gotten an email where they ask a series of questions, but there's a lot of questions and a lot of various things they can ask. So sometimes people don't even realize they're being asked these questions, but they sometimes do wonder, why does my doctor need to know if I'm involved in my community or if I go to church? Because we know that if you are involved in your community, you are in your church, you have a good support system, right? So these are things that are important for your doctor, your nurse practitioner, or your nursing, or whoever's kind of taking care of you to know.
Interesting. And so those are part of the screenings for this.
Right. So most of the time, people will screen for things that they can do about. Like we screen for, when you go to the doctor, we screen you for cholesterol and we check your blood pressure and those sort of things. So if we ask you a question about housing, like do you have safe housing? As a doctor, I'm not sure I want to ask you a question about housing if I don't have a good solution for you. So it's going to be very tailored to your practice, your organization, your community, and to the resources you have in your community. So if you're screening somebody for hunger, it's good to know where the food pantries are, how do you get them enrolled in a SNAP program, those sort of things. So those are sort of, each screen can be a little bit different.
And so what does a physician do with those answers when they go through the screenings?
Yeah, I think it just kind of helps you know your patients better. You can kind of look and see where they're kind of struggling. Because if your basic needs are not met, then meeting your medical needs are going to be even more difficult. So if I have a patient with diabetes and I know they don't have a good resource to nutritious foods, I'm not just going to come in and say, Robin, you need to eat better. We all hate that. It's going to say, what can we do to kind of help get you good nutritious foods that are good for someone who has diabetes, and what are the resources?
So interesting. So how does that apply to ACEs, and what are ACEs?
Right. So ACEs are called adverse childhood experiences. And so there's a whole list of common ACEs. Most of those are sort of trauma that we traditionally think of: physical abuse, sexual abuse, neglect. There's some emotional abuse around as well. But there's also this whole host of sort of household dysfunction, such as having a parent with mental illness, having someone who has been incarcerated in your family, or maybe being separated from a parent because of that incarceration, because of divorce. So these are really traumatic events that occur very early in childhood. Sometimes are repeated, sometimes are very intense, sometimes are very mild. But they are all things that sort of affect children's development of their mind and of their body. And we know that from research now that those all have long-term consequences on health. So that's why they're so important to kind of know about. And the other thing, if you go to the CDC website, the Center for Disease Control, and you just type in ACEs, you'll find under the prevention section. And so you'll see the original ACEs study that has been well documented, that those are really traumatic events that have significant impact on people's lives. But there's other things as well. So you'll see a couple of different adverse childhood experiences. But a lot of the things that we screen for in social determinants of health tie back to those adverse childhood experiences. So when you think about, we screen for maternal depression, that's one of the things. If you have a caregiver who's suffering depression, that can be traumatic to a child. If you have someone who has experienced substance abuse in the family, that may also have. So these are all important things that kind of tie together. So many times I think when people are screening for social determinants of health, the deeper issues are rooted in childhood and those adverse childhood experiences.
So interesting. So the higher the score on the screening means what?
Right. So the more, so there's this kind of a score from 1 to 10, and this is using the original ACEs study. So the more ACEs you have, the more likely you are to have difficulty with your health. So the more likely you are to suffer from mental illness, the more likely you are to suffer from chronic diseases such as high blood pressure, the more likely you are to use substances to kind of help with some of the impacts of trauma. So the higher the score, the more likely you are. But the score doesn't tell you everything. So I can say, Mrs. Jones has a score of 6. She's obviously experienced a lot of trauma, but she seems like she's doing well. So so we know that there's another side to that, and that's also how much resilience that people have. So even though you may have experienced a lot of trauma, you may have had a really good parent or a really good grandparent or a school teacher or somebody who kind of helped with those stressors, helped you manage them so that they didn't become so toxic and so traumatic.
And how common are these traumas? Is it an Arkansas thing? Is it a nationwide thing?
Yeah, sadly, Arkansas has some of the highest rates of trauma. So we do know that from good data that a lot of Arkansans have experienced trauma. So we know that it is common. The trick with ACEs, and when you're a kid and you're growing up, your mom is the only mom you had. And if she's struggling with mental health issues and substance abuse, that's pretty much your normal. So you may not realize even till adulthood what you experienced. We also know that ACEs cluster. So if you've experienced one, so if you experienced abuse, you're also more likely to experience some of the other things within that ACEs. But I think that for people to really understand is that they are common. It's not anything to do with you or what, you didn't do anything wrong, but that sometimes you feel very alone in those traumatic events, and to realize that a lot of people have also suffered those traumatic events. A lot of people are dealing with those traumatic events, and there's a lot we can do to kind of help make things better.
And how can healthcare providers be proactive with these?
Yeah. I think the main thing is thinking about using some sort of screening tool. I think social determinant screening is a great place to start. Sometimes doing a trauma screen or an ACEs screen can be kind of traumatic anyway. And I think it's something that kind of has to occur over time. For me, as a provider, it helps me know the family that I'm taking care of better. I don't necessarily need to know specifically what happened to them, but I recognize that this family is living with a lot of challenges. They may not have good housing. The parents may have a substance abuse problem. It may not be overt physical abuse, but, just verbal abuse and those sort of things that you can't see. So by knowing that, by acknowledging that, I can take better care of the family. I think it really builds a lot of empathy and a lot of sympathy if you've experienced trauma yourself, because you know what it's been like, to just kind of know your patient better and to address them, and then really build that trusting relationship that you have with them.
It's so important.
So, yeah.
So how does improving healthcare staff's knowledge of ACEs improve healthcare?
Yeah, I think it improves the whole culture of the office, because I think people recognize that, again, not just you have experienced trauma, but a lot of people have. A lot of people are coming in the door with that trauma. I think in the past we've talked about baggage, but they're walking in the door. So you have to kind of make that shift from what's wrong with this person to begin to think about what happened to this person. And you'll hear that a lot when we talk about trauma. It just kind of makes you kind of step back a little bit and be like, Robin's not coming to me and being mean to me or yelling at me because she's mad at me. She's frustrated because she didn't have transportation. She was late. Maybe she didn't have breakfast because she's run out of money this month. Maybe her, family member is having something to do. So it's not about us. And you can kind of step back and depersonalize and maybe approach that patient with a little bit more empathy, making a bit that statement. And I think it really kind of helps bring things down. It also helps you with your coworkers to know that it's not all about me, but to recognize that maybe they're going through some stuff, and to give people a little bit of grace. And I think that just gives the whole working environment and the whole relationship with our patients and families better.
Absolutely. So tell me about the training that AFMC provides for ACEs awareness.
Yeah. So AFMC realized, several years ago that a lot of, again, healthcare occurs outside of the medical office or the hospital or the nursing home. And so how important it is for people to, number one, be aware about ACEs and how it impacts healthcare and how it can contribute to poor health. And to begin just kind of building some awareness. So it's really, I describe it usually ACEs and learning about ACEs as a journey. So you kind of start with some awareness and then you kind of build from that. And it's taken me several years to really acquire a lot of knowledge and to get a lot of experience with how to respond to those things. So taking that and making healthcare providers more aware about ACEs and trauma, not just within the healthcare setting, but within their communities and their schools, and how to deal with their own family. But also how do they help with their patients? So where is a screening tool going to be appropriate? Should we screen for social determinants? How can we approach people a little bit better? But I think also what we have learned is that certainly you have that knowledge and it can be kind of overwhelming at first, but like, how do you respond to people? So say I've never experienced, sexual abuse. So, how do I, with that knowledge that knowing how sexual abuse impacts a person over the long term, how can I best kind of interact with them and respond to their needs and understand what they went through in a kind of a trauma-informed way? So there's some very practical approaches that offices can do, communication skills, all sorts of ways within the system from top to bottom, how we could improve and become more trauma-informed so that we make patients feel safe, they feel nurtured, they have a place where they can go, where they can get good health care. So AFMC really has worked to develop trainings to kind of work with medical providers and with staff. So it's everybody from, the cafeteria worker to the person at the front door, to the person who does scheduling, to the person who checks them out, to the person who follows up with them, So all those people are sort of aware of the impact of trauma.
And do you see that our physicians and clinics taking advantage of that, or are you wanting more of an outreach within the state?
We definitely would feel like we have a good opportunity for outreach. The problem is it takes some energy to do that, right? So it's something that, because when you're addressing other people's trauma, you sort of have to address your own. And it also can be kind of scary to get into this because you're worried that you're going to trigger people or you're going to further traumatize them. But there's good ways to kind of take care of those patients. So we'd really like to see this expand throughout the state. Again, we're a highly traumatized state. So a lot of the people we're taking care of are traumatized. So getting people to understand that, to begin to create some change. And I think that over time, what we know about ACEs now can prevent for ACEs in the future. So we can kind of start to put in some safeguards or some preventive means to help reduce trauma.
And so there are some opportunities coming up with the Arkansas ACEs and Resilience Summit. Tell me a little bit about that.
Yeah, we're really excited about this year's summit. Over the years, we have really focused on adverse childhood experiences, and we've talked a lot about that in the research because there is a lot of information. I think we could all recognize that the pandemic was rather traumatic for all of us. We had 2 summits that were virtual, which were great, but a lot of the protective factors around trauma are about connectedness, so bringing people together. And I think we all realize how much, even if you're the biggest introvert, you still need people, right? So we're really excited to bring everybody back together in person. We are going to offer a virtual option so people don't have to travel, or if they don't feel safe coming to a larger event because of infection, not just COVID, but the flu or whatever might be going around. But this year's conference is going to be the power of belonging. So really bringing to people again, focusing on those positive things that occur within schools and communities and with homes that really help kind of take that trauma, kind of contain it a little bit, help people deal with it. But we know that positive childhood experiences are just as important, if not more important, than adverse childhood experiences. So we have a lot of really great focus on that. We have a really great researcher about positive childhood experiences, Dr. Christina Bethel from Hopkins, who's coming to do our keynote speaker. We're going to talk about everybody's role in the community and kind of protecting, whether that's education, policy. We're going to talk about diversity, equity, inclusion, and how important it is that everyone feels like they belong to the community, that really protects children and helps protect adults and helps prevent re-triggering people. But I think healthcare providers and anybody who's an advocate, anybody who's a teacher, people are worn down. And so the last part of the conference is really going to be about some self-care and some really kind of things that we can do, because if we don't take care of ourselves, we can't take care of other people. And so we want people to walk away, not just leaving with this weight of the idea of trauma on their shoulders, but something where they feel uplifted and rejuvenated and walk away inspired and ready to go back into their community to create some positive change to kind of help counter those adverse childhood experiences. So we're very excited.
It sounds amazing. Yeah, it sounds so good. I want to go.
Yeah, well, come on.
and it's not just for providers. I mean,
right.
Who do you think should attend?
Families, educators, anyone who's involved with policy, with around education or healthcare. Nurses, school nurses would be great. Foster care families, community leaders, those civic leaders, people who are in the chamber, we'd love to see some legislators there, or anybody who's sort of in those kind of decision-making roles in our communities, because we have to recognize that sometimes what we do further traumatizes kids, and we really need to shift to how we can protect kids and how we can create more of those, again, positive experiences.
It sounds great.
Yeah, we're excited.
And it's going to be in August.
It's going to be in August. It's going to be here in Central Arkansas at Pulaski Tech, and we will have the virtual option available. Sometimes it's hard to drive all the way to Little Rock and then drive home in one day. So we want it to be a restorative experience and not an exhausting one. So, yeah.
Well, it sounds like it's going to be an incredible event.
Yeah, thank you.
Well, Dr. Rodgers, thank you so much for joining me today. And that's it for this edition of AFMC TV. Thanks for watching and have a great day.